Good afternoon. My name is Carolyn Trowbridge, and I am from Service Employees International Union. And I want to talk about, mostly about John McCain's healthcare plan. As we all know, the U.S. healthcare system is broken. Escalating costs, grossly uneven quality of care, and the immoral growth of the uninsured population, now estimated, last I saw, at 50 million, has led to agreement that the U.S. healthcare system requires some sort of reform. Democrats and Republicans, however, remain sharply divided over how to reform it. And this is evidenced by the healthcare plans offered by John McCain and Barack Obama. And those plans would take the U.S. healthcare system in very different directions. McCain's plan embraces market forces and promotes individually purchased insurance. McCain's plan also depends on deregulation and looks suspiciously like John McCain's 20-some-year career in Congress deregulating the financial sector. If you like the results on Wall Street, just wait to see what happens to Main Street and healthcare. The centerpiece is a change in the tax treatment of health insurance. Currently, workers do not pay taxes on health insurance premiums paid by their employers. This is the result of a grand bargain of shared responsibility among government, labor, and business that came about following World War II. This was in an attempt to stave off the universal health care that at the time the people of the U.S. were clamoring for. All those troops had been to France and knew what health care looked like and wanted it here at home. Labor and working people ultimately got snookered in the deal. But that's another story. The McCain plan would eliminate this tax exclusion, making workers pay taxes on their health benefits as if they were income. The plan would then use the revenue generated, projected to be by the McCain campaign $3.6 trillion over 10 years, to pay for refundable tax credits for Americans to obtain private insurance. $2,500 for individuals, $5,000 for families. The thing is, McCain himself doesn't even seem to remember the details of his health care plan, at least during debates. Uninsured Americans could use their credits to help buy insurance coverage on the individual market, and workers with employer-sponsored insurance could use their credits to offset the cost of paying taxes on their employer premium contributions. Or, if they weren't in an employer premium contribution plan, purchase individual coverage on their own. There are several problems with this. The first is that projecting revenues in an economic durntown is about as foolish as you can get. Second, with no controls over or regulation of the insurance industry included in this plan, there is absolutely no guarantee that most Americans with pre-existing conditions, which is literally all of us, we have high blood pressure, we're overweight, we have allergies, we have asthma, we don't exercise, all of us have something pending. So those people, or us, would be able to purchase individual insurance. Third, there is no indication that these credits are enough to purchase any kind of comprehensive care. $5,000 for a family from the credit actually leaves a huge gap in the real cost, which is about $12,000 that it typically costs a family to currently buy a family plan in any insurance market. Instead of regulation, McCain offers initiatives at spurring competition. Instead of cost controls, we have something that is not really going to change the status quo, which is the insurance industry. Allowing desperate people to buy insurance across state lines, which is one of the things that's supposed to encourage competition, crossing state lines to buy a cheaper insurance policy in a state that has less regulation. Less regulation means they don't mandate comprehensive care. Cheaper insurance means they may not cover your mammogram. Cheaper insurance means you get this much in terms of treating your cancer. And So this is what happens in moving across state lines to purchase health insurance. You would actually have a problem in getting your actual needs met. McCain's plan also calls for changing the way Medicare pays for medical services, moving away from fee-for-service reimbursement towards bundled payment of episodes of care and payments based on outcomes. Fewer benefits, less care, less oversight. And lastly is the notion that if you had less coverage, you would shop around looking for the best deal. Now, I worked in hospitals for almost 35 years, and I don't know how to shop around for hospital care, or for doctors, or for best deals. And that you would be more frugal in your use of medical service. This part of the plan is based on the assumption that working people in this country are both stupid and greedy, and now just overuse the healthcare system just because they can. This is so offensive that it doesn't even deserve comment. This plan is supposed to spur competition and efficiency. What it would truly do is lead to less care, more disease, more pain, more suffering, more death. The invisible hand of the market is absolutely inappropriate in the world of healthcare. Most uninsured Americans would remain uninsured under the McCain plan. Given the high price of health insurance, even with the new tax credits, most lower income people still would not be able to afford coverage. And if the credits are not indexed to the rate of growth in healthcare spending, that affordability gap would grow over time, as would the number of Americans who would pay higher taxes for employer-sponsored health insurance. This is actually raising taxes on working people, something McCain always claims he never does. So the higher the taxes, more employees would have to opt out of employer-sponsored health insurance, thus totally destroying the employer-based healthcare insurance system. United Auto Workers sent out a flyer following their assessment of the effect of the McCain plan. And this is based on the gap between the McCain subsidy and what it would cost and what workers currently receive in terms of health insurance. McCain's plan to tax workers' health care benefits as income would eventually cost the typical union family almost $3,000 per year, $2,800 per year. This tax, mind you, also applies to retirees to accommodate these costs. And these are people who cannot adjust their incomes to accommodate these costs until they qualify for Medicare, assuming that the McCain plan hasn't destroyed Medicare by then, leaving them in a total lurch. McCain healthcare reform, it's bad for workers, bad for families, bad for America. We don't need more people falling through the healthcare cracks. Our ERs can't absorb more sick and desperate families looking for help. America's working families are looking for hope and help. We don't need more of the same Bush-McCain care plan, health care plan, which is don't get sick. What we really need, what the working people of America need, is affordable, quality health care for all now. The McCain plan will not deliver what the American people want and need.